Hi there, here's the One Team Working Covid-19 update for today, Wednesday, the 1st of April. First of all, again, here's our YouTube channel. So, reporting from the social care frontline, here is the link. This is about staying connected, sharing stories from the services, reporting what it's actually like on the front line within social care. We realised that with the GoPro footage, etc., that you might be capturing, it might be too large to send in email format. We would recommend sending any footage in general through WeTransfer, which it's free, it's a secure file transfer site, and you can send more than one videos in one transfer. So please do visit the website wetransfer.com to send your videos to us and keep them coming, really greatly appreciated. There's a little bit more information here on staff isolation. Obviously, where staff are required to self-isolate, do follow the government guidelines. If you are in need of any provisions, please do let us know, because we can arrange for provisions to be sent and delivered to you, and we can also pick up medications that you might need. Also, during self-isolation, we'll be doing wellbeing calls to you to make sure that you're okay and give you any other sort of additional resources or levels of support that you need. If you are a carer, or you may be concerned about a family member that's elderly, or a key family member, also we can look at the possibilities to make sure there are welfare checks to those family members. So those kind of conversations will happen when you first go into self-isolation. But that's because we want to support you as much as possible in those circumstances. For the individuals, in terms of self-isolation, it's all been added to the wiki. So the key protocols on what you should do are on there. It's about minimising risk for those individuals who might be displaying symptoms from passing them on to others. Also, we are continuing to review daily the individuals who are particularly vulnerable to infection, in terms of implementing second type of protective isolation or shielding. All these protocols are quite similar in terms of isolation, and support staff can find all of that on the wiki, so please do have a look. We received a lovely message from a Kirkhouse parent. Obviously, these are really difficult times for families. They're not able to visit their young people. It's a lot of uncertainty, not sure what's happening. So it's nice to hear messages like this come back from parents, but also, remaining in contact with those parents so that they can remain updated on what's happening at all times, which is so crucially important, which is why our daily diaries within the YouTube channel are very well received as well. Anything you can send to us that we can share, please do, because families really do appreciate anything we can send to them that just gives them that little bit of peace of mind, and also updates them on what's happening. A message to volunteers: thank you so much for everybody who's volunteered their time, or their friends and family, or members of the public even have come forward. Obviously, things are progressing day to day, things are changing on a daily basis. We always have to consider the risk to the individuals. So what we're thinking is that it'd probably be support with the social care exchange in terms of packaging, distribution, food and supplies to the homes. But we've set up a volunteer email address, volunteer@homefromhomecare.com, asking people who are interested to be a volunteer to send their details or an email just to that email address. But thank you so much to everybody who's volunteered. We really do appreciate it in these difficult times. You're all stars, thank you. If you're worried at all, remember there is the absence line. If you select number 2, the COVID-19 support and queries, there will be someone there who can support you. So please do use that telephone number if you have any concerns. Again, just showing some photos from the homes, some lovely photos coming through, lots of swings in action. The social care exchange, lots of signage up around coronavirus. In terms of staff rotas, just saying again, we need your help. So we are setting up standby shifts within rotas, and this is really so that we can minimise the amount of staff that are moving from one home to another, to reduce the risk of spreading infection. It's voluntary to add yourself to a standby rota, but obviously, once you are on that rota, you're committed to working a shift if there are any absences on that day. So please be mindful of that. But you are all doing a fantastic job, and we are all one team, and we just want to say that we appreciate you but also with this, if you can add yourselves, help us, help the services by adding onto these standby rotas, that would also be very much appreciated. And again, some lovely photos of activities going on in the services, so please do keep them coming. It's lovely to see and lovely to share. All right, thanks everyone, take care, see you tomorrow.